Chikungunya is a virus, transmitted to humans through the bite of an infected mosquito. These infected mosquitoes can also carry other diseases like dengue and yellow fever. Chikungunya can be found throughout the world, including the Caribbean, tropical areas of Asia, Africa, South America, and North America. There's no cure, vaccination, or treatment of the disease. Instead, treatment focuses on relieving symptoms. Identifying signs and symptoms. It's important to identify the signs and symptoms of chikungunya, treat the symptoms, and be aware of complications from the disease. Acute phase. The acute phase of a disease is a rapid, but short-lived period of time where you experience symptoms of the disease. There may be no symptoms for up to 2 to 12 days after being bitten by an infected mosquito. You may experience these symptoms during the acute phase. Fever. The fever is usually 102 to 105 degrees Fahrenheit and typically lasts from 3 days up to 1 week. During this time, the virus accumulates in your bloodstream, spreading to different parts of the body. Arthritis. Joint pain. You'll usually notice arthritis in the small joints of the hand, wrist, ankles, and larger joints, like knees and shoulders, but not the hips. Your joints may also look swollen or feel tender to the touch, and you may have inflammation of tendons. Joint pain usually resolves within 1 to 3 weeks, however, in some cases joint pain can continue for up to a year. Rash. Approximately 40% to 50% of patients experience a rash. The rash usually starts on the upper limbs followed by the face and trunk/torso. Make sure to turn around to look at your backside, back of neck, and raise your arms to examine your underarms. Subacute phase. The subacute phase of chikungunya happens a month to 3 months after the acute phase of the illness ends. During the subacute phase, the main symptom is arthritis. Aside from this, disorders of blood vessels like Raynaud's phenomenon can occur. Raynaud's phenomenon is a condition where there is decreased blood flow to the hands and feet in response to cold or stress on your body. Chronic phase. This phase starts following the 3 months from the initial onset. It's marked by the continuation of joint pain symptoms, with 33% of patients experiencing joint pain, arthralgia, for 4 months, 15% for 20 months, and 12% for 3 to 5 years. If you have underlying joint problems, like rheumatoid arthritis, you're more prone to developing the chronic stage of chikungunya. Other symptoms: muscle or back pain, headache, sore throat discomfort, abdominal pain, constipation, swollen lymph nodes in the neck.